There's a common childhood illness where a rash is actually the good news. Sounds weird, right? Well, today we're cracking the case of roseola, an illness that often throws parents for a loop because of its very specific pattern, a super high fever before a rash ever shows up.
So picture this. Your little one is playing, totally happy 1 minute, and then bam, they are burning up. The thermometer shoots up to 104 degrees Fahrenheit, that's 40 Celsius, and it seems to have come out of absolutely nowhere. For any parent, that is a seriously alarming moment. But here is where it starts to get really strange. Despite that crazy number on the thermometer, your child might not even seem all that sick. When the fever comes down for a bit, they might be up and playing, almost like nothing's wrong. Their behavior just doesn't seem to match the temperature. This whole confusing picture, the crazy high fever, but a kid who seems relatively okay, that is the classic calling card of roseola. So let's break down this little medical mystery. That way you'll know exactly what you're looking at if it ever shows up at your house. All right, let's dive into phase one, the sudden high fever. This is the part that, understandably, causes the most worry. The thing about this fever is just how abrupt it is. It doesn't slowly creep up. It just appears, spiking really high, often up to 40 degrees Celsius. And it can stick around for anywhere from 1 to 5 days, which, let's be honest, can feel like an eternity when you're a worried parent. And besides that really dramatic fever, any other symptoms are usually pretty mild. You might see a little cough, maybe a runny nose, or even some mild diarrhea. But again, the main thing most parents notice is that the child just seems pretty well despite it all. Okay, we do need to touch on this point. That super fast spike in temperature can sometimes trigger what's called a febrile seizure. Now, while these can look really scary, it's important to know they're caused by how quickly the fever rises, not how high it gets, and they're typically harmless. So after a few days of that intense fever, just as suddenly as it appeared, it vanishes. And this is where we get the signature plot twist. The fever breaks, and then a rash appears. This timeline here shows the sequence perfectly. You've got the high fever for a few days, and then, only after the fever is totally gone, the rash shows up. This timing is absolutely everything. It is the #1 defining feature of roseola. So what is this thing officially? Its medical name is Roseola infantum, but it's also called exanthemus subbitum, which literally translates to sudden rash. How perfect is that? It's a common viral illness, usually from human herpes virus 6, and the name itself perfectly captures that unique fever-then-rash pattern. So, what does this rash actually look like? Well, it usually pops up on the trunk first, so the chest, back, and belly, and then it spreads out to the neck, arms, and legs. It looks like small, pinkish red spots that can be flat or a little bit raised. And here is a super important detail. It's non-paritic. That's just the medical term for not itchy. Okay, so you see the pattern, but how can you be sure it's actually roseola? Let's talk about how doctors identify it and which kids are most likely to get it in the first place. And here's some really great news for parents. The diagnosis for roseola is what's known as clinical. All that means is a doctor can figure it out just based on that classic story, the high fever that disappears and is followed by a rash. No swabs, no lab tests needed. The pattern tells the whole story. And as for who gets it, well, there is a very clear peak age group. It is most common in infants and toddlers between about 6 and 18 months old. So if your little one falls into this age range, roseola is a really common, almost expected part of growing up. Really, this quote sums it all up, doesn't it? The diagnosis is made when the classic rash appears after the fever disappears. That rash is the final clue, the definitive sign that tells you exactly what you've been dealing with. Now for the really practical stuff. What do you do at home? Thankfully, it's pretty straightforward. All you need is simple supportive care. So the care plan is incredibly simple. First, you can use fever reducers, what we call antipyretics, just to keep your child comfortable during that fever phase. Second, push the fluids, keep them hydrated. And third, and this one's important, provide reassurance. Just knowing what's happening can calm a lot of anxiety for you and your little one. And maybe the most important thing to remember when you're managing this at home is that roseola is a self-limited illness. That just means it goes away all by itself. No special medicines or treatments are needed because the body's immune system takes care of it, no problem. Of course, anytime a rash appears on your child, your mind can start to race. You wonder, is it this, or could it be something more serious, like measles?
So let's quickly compare roseola to other illnesses that cause rashes so you can easily spot the difference. Just look at the key difference right here in this top row, the timing. With measles and rubella, the rash shows up with the fever. With roseola, it is always after. Also, look at the child's appearance. A child with measles looks very, very sick. A child with roseola, as we said, often looks surprisingly well. That timing is your #1 clue.
So when it comes down to it, what's the real key to telling the difference? You just have to remember what comes first. If it was a sudden, high fever that's now gone, and then a rash appeared, you are almost certainly looking at the strange but reassuring case of roseola, where that rash isn't the problem, it's the sign that it's all over.